Have you ever woken up in the middle of the night with a throbbing toothache or noticed that your gums were bleeding and wondered? Have you ever put off going to the dentist because you thought waiting it would just get better, but it got worse? Or you were worried that those dental x-rays would be harmful instead of good for you? Welcome. Those questions are exactly why we're here today. Hello, everyone. I'm Janice Wood. I'm so glad you're joining us today. On the Senior Citizens Forum, we're going to be discussing myths and misconceptions of dental hygiene, the things we heard for years but may not have known the full story. Does oral health really affect the rest of your body? Are bleeding gums something to ignore? And when is actually waiting making it worse? To help us separate fact from fiction, Dr. Henry Kim is coming back on the Senior Citizens Forum. Dr. Kim, welcome to our Senior Citizens Forum.
Thank you for inviting me back.
Yes, I'm so excited to have you back. Well, Dr. Kim, welcome back to a Senior Citizens Forum. In the past, we've had some really interesting discussions. So if anybody is interested in from implants to healthy teeth and healthy mouth. But today we're going to be talking about myths and misconceptions in the dental hygiene world.
Okay.
But first, let's talk about you for a little bit. You graduated from Harvard.
Yes, I went to Boston University Dental School to get my dental degree. And I did my postdoctoral training in prosthodontics at Harvard for 3 years after the dental school. Yeah, that's already almost 28 years ago, or 26 years ago.
That's always hard to believe how time goes by so quickly.
Yes.
But let's talk about some of the misconceptions.
Sure.
So in my greeting, we talked about, okay, you have a toothache.
Yes.
You wake up and it hurts. You shouldn't be ignoring it as far as I'm concerned, but people do.
Right. Well, there are a number of things that are causing pain in your mouth. It could be dental origin, or it could be how we say is a gingival origin, that is from the gum that you may have pain. So if it's a dental origin, normally you should have a very sharp pain that shoots through the tooth, and sometimes it's too much to bear. If you have a pain from gum disease or from your gum, oftentimes it's more of a throbbing ache because of the gum is swollen. So you could distinguish those two types of pains from how the pain manifests in your mouth.
Yeah, but when it hurts, it hurts.
Yes, it hurts.
Yeah.
That's why we're here to serve.
That's why we're talking about that. So one of the things I think people, let's go back even a little farther. One of the people don't realize that your mouth, what goes on in that affects the rest of your body. I know people don't believe that it affects the rest of their body.
We do know that the bacteria from your oral cavity can travel into your system via the blood vessels. So if you have a lot of gum disease, which causes swelling of the gum and bleeding of your gum, it's easy for the bacteria to get introduced into your blood system and travel through your body and end up in certain organs. So sometimes it can end up in your heart. You end up with endocarditis, and oftentimes you find oral bacteria in such case. So we want to make sure that you have a healthy mouth and good, healthy oral condition, so that those bacteria doesn't get introduced into your overall system.
So how would you go ahead and prevent that? Say I'm somebody that's like, doesn't believe in going to the dentist, okay? And I haven't been to the dentist for years because I think the x-rays are going to be harmful. Do more harm than good.
Yeah.
So why are x-rays not harmful?
First of all, I always tell my patients, clean teeth means healthy gum. So when you have clean teeth, there's less bacteria that's built around the tooth that will cause the gum disease, so that you will have less bleeding of your gum, so that you'll have less bacteria getting into your blood system. So in order to maintain healthy oral condition, you need to have clean teeth. where a lot of the bacteria will adhere to and then harbor. So that's number one concern. We want to make sure you are doing your job at home to maintain your oral hygiene at home so that you will have less bacteria in your mouth, on your tooth surfaces.
So that leads into something else, okay? So if you're looking for just brushing your teeth doesn't really do it.
Well, we want you to make sure that that you do your part at home. That is to say that you brush your teeth, floss your teeth, maybe even use water pick to make sure that you're getting rid of whatever the food debris that you might have collected over the day, throughout the day, and get rid of plaque buildup on your tooth by brushing, flossing, and water pick.
There's a lot of different types of instruments that you can buy.
Yes.
Okay. Like I see those little, I don't know what to call them. I want to say a horseshoe, but it's not a horseshoe. It has like a string going across it.
Right. And it's a dental floss that's connected to a little holder. And yes, oftentimes those are very helpful because you can actually reach more difficult areas with the dental floss that way. So whatever you can get your hands on to achieve that goal of clean teeth, I would recommend, just about anything that you can, use to do that.
Because I'm a little fanatic about my teeth, okay? Yes. I look at it in a mirror that's like 15 times,
Right.
And I look in there and go, oh my God, look at all that stuff. I thought brushing was going to get it all. And I use an electric toothbrush.
Right.
I've used hand toothbrushes, and it doesn't get it all.
Right. Oftentimes what the patients end up doing is that they just kind of go through the motion of brushing and they do not realize that they have skipped over a few teeth. So I always tell patients to kind of use your tongue to kind of go over each tooth and make sure the teeth are nice and clean. And if you feel that there's something still left on the tooth, go back to that tooth and brush that tooth until you feel that teeth are clean.
Well, I know a lot of people are afraid to go to the dentist.
Right. So like you mentioned, dental x-ray is one of the concerns for a lot of patients because they don't want to be exposed to radiation. But the dental radiation that we use is a very minimal amount of radiation. So you'll be assured that it's safe. I know some states don't even require you to have the lead apron on during the x-ray taking. But, for your precaution, I know a lot of the offices will still use the lead apron to minimize the exposure of your body to x-rays.
But those dental x-rays, they can catch so much.
Right. So,
it's going to show you as the dentist if there's decay.
Certainly using the dental x-ray to get the radiograph to show what's going on beneath the gum and inside the tooth is very helpful to determine the origin of the pain.
Yeah, so when you don't see the dentist on a regular basis, that plaque, that germs or the food that gets caught, one can create gum disease.
Right.
Okay.
Right.
Or does that plaque also cause tooth decay?
Oftentimes the patients don't realize that the oral disease that we get, dental decay and gum disease, are what we call the infectious disease caused by the bacteria that we have in our mouth. Everybody has bacteria in mouth, but when the level or the number of bacteria increases because you haven't taken good care of your teeth by having a good hygiene habits at home, that's when the bacteria become more active to cause dental decay or the gum disease. Oftentimes people or patients think that it's the sugar or it's the plaque that's causing the dental decay or the gum disease, but it's in fact the bacteria that's in your body, in your oral cavity, that will cause dental decay and gum disease. So we want to make sure that the critical number is not reached. We want to make sure we minimize the bacterial count in your oral cavity so that those disease can be prevented.
So you just mentioned the word sugar.
Yeah.
A lot of people drink a lot of coffee.
Yes.
And I see them add tons of sugar to it. Or they're drinking sodas.
Right.
With both artificial and sugar.
Actual sugar, yes.
So with the artificial sweeteners, can that be just as bad as sugar?
Right. They're all, say, food for bacteria. So in fact, when you take in a lot of sugar and retain the sugar in your oral cavity, it activates those bad bacteria that's causing all those disease. So we want to make sure that your mouth has less carbohydrates. That lowers the pH. That is to say, your mouth becomes more acidic. When your mouth becomes more acidic, then these bacteria are more active. They like acidic environment. So especially the sodas that you may be drinking not only provides sugar, but because they're acidic in its nature, now your mouth becomes more prone to dental decay because of that. So you're activating not only the bacteria, but you're feeding the bacteria to become more active. And the acidity of the drink itself now is causing what we call the demineralization of the enamel. And that's where the decay starts.
And that's where that toothache may come from at some point.
Right, because that dental decay starts to move through the tooth and enters first the enamel and then into dentin. And once it gets to dentin, that's the inner layer of the tooth, it's more organic. That's to say there's a lot more nerve endings that are coming from the pulp of the tooth towards the outer surface of the tooth. So now when the dental decay becomes deeper into the tooth and enters the dentin, that's when your tooth becomes more sensitive.
So when you're talking carbohydrates, okay, so we mentioned artificial sweeteners and sugar. So if you're eating some pasta,
that's also sugar or considered carbohydrates.
Or that. Of course, we were just talking earlier and I said I was a bread fanatic.
Right.
Okay.
Right.
That's all carbohydrates.
Yeah. So anytime you actually take in food, your body wants to digest the food. And for proper digestion from the mouth all the way to your stomach, things become a little bit more acidic by process. And because of that, we want to make sure that we get rid of the acidity in the mouth soon after taking the food by brushing your teeth, by rinsing with the water at least, so that we don't allow the teeth to be exposed to that acidity for a prolonged time.
So I would ask you, does genetics have anything to do with any of this?
Maybe perhaps, yes, genetics. If your body produces more acid, or let's just say if you have acid reflux, gastric acid will eventually come up and could cause more erosion of the teeth. Something like that could be considered as genetically related, or your mouth, may be naturally more acidic than other people.
So it's really important to go to the dentist on a regular basis.
Yes.
What would you consider a regular basis? Not once every 5 years.
No, not once every 5 years. I would say that you're going to have a constant development of plaque buildup on your tooth surface. And those plaque will just stay on until you get rid of them. But the plaque you can get rid of by simply brushing your teeth. But once they start to calcify, they adhere to the tooth surface. Once they adhere to the tooth surface, they're called calculus or tartar. Once they become tartar, you can't brush the tartar off your teeth. So nowadays, we would really strongly recommend patients coming in every 3 months for dental cleaning. It used to be every 6 months, but every 6 months is too far apart. So if not every 3 months, maybe every 4 months. Even those patients who have immaculate hygiene at home, they tend to build a lot of plaque and tartar in 6 months, which in turn can cause gum disease because the tartar will harbor a lot of the bad bacteria that's causing the gum disease.
Yeah, and I find out as people get older, more things get caught in between the teeth.
What's happening is that the gum level and the bone level over time with the even with the mild level of gum disease will have recession of the gum, recession of the bone. And as the gum and the bone recedes, it exposes more spaces in between teeth. And because the more spaces created, now you have more food getting caught in between teeth. So it simply means that you have to spend more time as you get older to clean your teeth. Nowadays, we do recommend water pick, where it's pressurized water can shoot the loosen the plaque or food much better than you would with just simply using the floss itself.
All right, this has always been interesting. I mean, there's always so much to cover.
I know, but this is a very basic. A lot of patients don't realize how important it is that to have a good oral hygiene at home and have develop a good habit in order to really keep your teeth clean, in turn gum healthy, in turn keep your body healthy.
So important.
Yes, it is.
Because you don't realize all those germs that come in.
Yes.
Because even I, with my toothbrush, I always make sure I clean it. And if I get a cold, I changed the head on the electric toothbrush.
That's great. Yeah.
Because it's germy.
Well, that's one reason why you would want to change your toothbrush every so often. You want to change your toothbrushes because the bristles, they lose their elasticity or they lose the strength.
I always find that when I run out of a toothpaste, that's when I change my...
Yeah, well, that's one system you can use.
And if I get sick, I always get a new toothbrush.
Yeah, that's a good practice, and then certainly that will help you to keep the toothbrush clean and less bacterial or viral buildup.
Well, just like your towels and washcloths.
Yes.
They build up bacteria. Yes. So does the toothbrush.
I think that's a good practice. So every now and then you want to change your toothbrushes.
It's just really quick. So if people are watching this and they have little children, those baby teeth are really important also.
Yes, the baby teeth should be also taken care of. So I would recommend all those young parents to really encourage their children to brush their teeth really well. If not, help them brushing their teeth and showing them where to brush and how to brush.
It's very important.
Yes, and it's very important for them to develop a good oral hygiene habit from the early ages, so that as they grow up, that once they go to college, you don't know whether they're taking care of their teeth or not, right? Because parents are not always around. So it's important that you help them to develop a good habit.
I have another myth. If you keep brushing your teeth, will that take away the enamel? Can that do that?
Yes, you can do that. You can actually abrade the teeth enamel surface away.
Everything has evolved so much.
Yes.
Okay. Yes. And I saw you give a talk the other day about AI and how it's changing dentistry.
Yeah.
And you don't think about this is a field that's also changing.
Yeah.
So the horror things that we used to hear about from 20, 30, 40, I can go back farther than that. 50 years ago, you get a dentist that created pain for you. Well, one, I would say get a new dentist.
Right.
A lot of dentists do not create pain.
Dentists are here to get you out of pain, not to create pain.
Right.
But just like any other field of medicine, oftentimes when we do certain procedures, it's what we call the controlled trauma. So let's just say if we're trying to get rid of dental decay, we have to drill into the tooth. So way back when the dental anesthetics wasn't very prevalent, so then oftentimes the patient or the doctor will drill into the tooth without the anesthetics. And that certainly is a lot of pain for a patient. I remember I had my tooth filled. I don't think that dentist gave me anesthetics. But that's almost 40 years ago.
Right.
But nowadays we have a very good dental anesthetics that we can use to minimize any kind of sensitivity or pain, so that patient can stay comfortable during the dental procedures while we're getting rid of the dental decay from the tooth and not cause tremendous pain for the patients. So we have come a long way in that regard. Maybe in another 40, 50 years, we will have, I don't know, maybe a machine taking care of those dental fillings. All by robots. Yes, exactly. With the AI, artificial intelligence. I think that still has a long ways to go. But currently we do have a good technology, and we have a very good dentist with the full of knowledge and skills to take care of the patients.
So if you've had a bad experience with a dentist,
yes,
I would say try another dentist.
Yeah, I think we are educated well enough about dental phobia that we understand where the fear comes from. Oftentimes it's from the bad childhood memory. Like I said, my first visit to dentist with that dental anesthetics to have a filling done, seeing a smoke rise, things like that from drilling. That certainly can, instill a lot of fear in a lot of patients. So your dentist has a good understanding of dental phobia and how those childhood memories can affect current situation. Maybe then you will have easier time, going through a dental procedure with those dentists.
And if you have some fears, talk to the dentist before you start.
Yeah.
I would think that would be open up the conversation.
Absolutely.
So they're aware of what's happening.
Yes. So make sure you tell your dentist that you had those experiences.
One of the things that we haven't discussed is the different metals that go in the mouth.
Right.
I remember in my days as dental assisting, mixing the silver filling.
Right.
In a machine that went like that.
Yeah. Mix the mercury.
They still use that?
I think some doctors are still using them. I know there's some heated debate about, whether it's going to affect your overall health or not. Overall, we know that it has been a safe dental material to use. Nowadays, they have veered away from using dental amalgam, and now they're using resins or composite resins that's what we call the tooth color fillings nowadays. Because we have developed a bonding system between the resin and the tooth surface, longer lasting, we are now mostly using tooth color fillings.
Okay, good. But I have another one I wanted to ask you about. And that's teeth whitening. Does that affect the structure of the tooth at all? Or?
Tooth whitening works with the peroxide, bromide peroxide that we use for the whitening. And basically what we do with the peroxide is that we bubble out all the stain that are caught, I guess we can say, pores of your teeth. And we want to bubble that out with the peroxide. And that's how the whitening works. So does it damage your tooth? Not really. But it can cause sensitivity of the tooth simply because we are kind of opening up those pores where the nerve endings might be. And because of that, after we do the whitening, we provide fluoride to cover up those open pores.
So when I'm doing tooth whitening at home, I should be doing some fluoride along with it?
The strength of the peroxide that we give you for take-home whitening is not so high, so that you can simply just use the toothpaste, meaning like you can just rinse your mouth out after using the whitening solution that we provide for home whitening, and simply brush your teeth with the toothpaste that you have at home, and that should be enough to reduce the sensitivity. If not, your dentist should be able to provide you with fluoride varnish or anything like that to reduce the sensitivity.
So that takes us now to the myths on the fluoride, because we're hearing all this stuff right now about fluoride not being good for you.
If you have too much of anything, it's not good for you. But if you have a proper amount of fluoride, then I think it's good that it will strengthen the enamel surface. If you have too much of fluoride, you end up with something called fluorosis, and then you end up with a darkening of the tooth, or maybe even a negative effect on the enamel. Obviously, you don't want to just suckle on like fluoride candy all day long. But just having just about right amount of fluoride from your toothpaste, that should be enough to keep your teeth healthy and resistant to dental decay. But if you're trying to have too much of it, it certainly will have a negative effect.
Well, Dr. Kim, thank you so much for going through some of the myths and misconceptions of dental hygiene. And what I would say to everybody, please go to the dentist on a regular basis. It's a healthy thing for your whole body. And if you have any questions for Dr. Kim, please feel free to get in contact with us. We would love to hear from you. And if you want to see any other shows that Dr. Kim has done on a Senior Citizens Forum, please go on to E360 TV and you're going to find those shows on there.
Well, Janice, I thank you always for inviting me back.
Yes, it's always a pleasure. You're so full of fabulous information, and I know I won't have a toothache if I see
no,
you.
Hopefully not. Take good care of your teeth.
Thank you so much.
Thank you, Janice.